We have Democratic Congressman Dr. Bera. Congressman, react to the vote for me.
Yeah, Katie, glad to be on. You know, this is not a day for us to celebrate anything. A lot of patients are going to lose health care coverage. You know, your prior guest said we don't need another CBO score. We absolutely do, but if we take the last score, it tells us that 24 million, 25 million Americans are going to lose health care coverage. It's not a good bill.
Well, what do you do now? You didn't win this battle in the House. Do you hope that the Senate brings it back and makes it more moderate? What's next?
No, we've got to make sure the American public knows how bad this bill is. You know, as a physician, I don't want to go back to a day where patients who might have breast cancer, heart disease, can't get health insurance coverage. You know, they may try to sell protecting pre-existing illnesses. Those states that opt out, those individuals are not going to be able to afford to get health care coverage. And what do they want to do? They want to give a big tax cut to millionaires and billionaires. This is not what we ought to be doing.
Congressman, in your assessment, what specifically was wrong with this bill?
Well, a couple things. We ought to want to get more people covered. So the first CBO score that came out said millions of Americans would lose their health care coverage. That's bad. This is a bill that allows health insurance companies to raise premiums on older Americans. That's bad. This is a bill that, with any of the savings, they're giving a massive tax cut to the richest Americans. That's bad. That's moving in the wrong direction. Let's get Republicans in the room. I think they know this is a bad bill, which is why they did this in the dark of night and as quickly as they did. Let's get together. Let's talk about how to lower the cost of care. Let's talk about how to get more competition in here. And that's been the problem over the last 7 years. You haven't actually tried to solve those health care cost issues. That's where we have to go next.